Suspected of having a traumatic injury, the first thing you can do is simply place him in the recovery position. In other words, put them on their side. This prevents the tongue from relaxing and moving back into the airway and occluding it. Additionally, if the patient happens to vomit, they are less likely to aspirate. If you do not suspect that the patient has a cervical spine injury, you can simply do a head tilt chin lift. Essentially, place one hand onto the forehead, the other hand underneath the chin, and lift. This pulls the mandible forward, relieving any obstruction caused by the tongue and the pharynx. The cervical spine injury, what you will do is called a jaw thrust. Take 3 fingers, place behind, underneath the jaw, and essentially you're going to manually move the jaw forward while taking your thumbs and pulling the jaw down. Basically, you're forcing them to have a little underbite. Now, note that if you try to do this on a patient who's awake, they're generally going to make this sound, ow, that hurts, please stop that. This is generally a painful thing to do to someone who's awake, but if someone is unconscious, I'm sure they won't mind that you are saving their life by opening up their airway. You can do a combination of the two for a patient not suspected of having a cervical spine injury, and that basically you do a head tilt chin lift with the jaw thrust.
When bleeding is severe, it can cause trauma for you. When bleeding is severe, it can cause trauma for you and the person you're caring for. Knowing how to control severe bleeding and prevent shock in an emergency situation can save their life. In this video, we'll teach you how to deal with severe bleeding, so you'll be more prepared in case of an emergency. If the person you're caring for is bleeding and you can't get it to stop or slow down even if you put pressure on it or blood is spraying or pumping out of the wound, then their bleeding is severe. If you think they're bleeding severely, call 911 immediately. Start by putting on a pair of disposable gloves if you have some available. If the person you're caring for is not laying down, help them to lay down in a safe place and put their feet and legs on pillows or anything you have handy to elevate their legs and feet. Try and see the area they're bleeding from. You might need to take off their clothing or cut clothes off with scissors to see where they're bleeding from. Using a towel or any fabric you have available and close by, put firm pressure on the area that's bleeding. If there is an object in the area that's bleeding, do not touch the object. Leave it in place and apply pressure around the object. If the area that's bleeding is on an arm or a leg and direct pressure isn't keeping the bleeding under control, you can use a belt or strip of fabric to tie a tight knot above the wound to cut off blood circulation to the area. If they begin to feel nauseated or start to vomit, turn them onto their side and make sure they don't choke. Keep talking to the person you're caring for. Make sure they stay awake and keep them calm. Reassure them that help is on the way and cover them with a blanket if they're complaining they're cold. Dealing with this kind of situation as a caregiver is very stressful. Make sure to take some time for yourself after the person you're caring for is safe and well. For more information about the signs of shock, see our care guide.
Shock bisa disebabkan oleh beberapa hal. Yang pertama, kehilangan darah atau cairan tubuh. Yang kedua, reaksi alergi dari suatu alergen. Dan yang ketiga adalah keracunan. Selanjutnya, apa saja gejala yang muncul? Yang pertama, gelisah, nadi cepat atau takikardi, kulit pucat dan muncul keringat dingin, kemungkinan badan gemetar dan menggigil. Apa yang bisa kita lakukan? Yang pertama, hubungi emergency call. Lalu, hentikan kemungkinan perdarahan. Tinggikan lutut kaki lebih tinggi dari jantung. Jaga kehangatan pasien dengan memberikan selimut. Dan yang terakhir, melakukan penilaian kembali terhadap kondisi pasien.
Help the casualty to lie down. If possible, try to lie them down on a rug or blanket, as this will help protect them from the cold. Raise and support their legs above the level of their heart, as this will increase blood flow to the head and vital organs. But if the casualty has an injured leg, do not raise it. If the casualty is pregnant, help them to lie with their body leaning towards their left side to prevent obstruction of blood flow returning to the heart. If you haven't done so already, call 999 or 112 and tell ambulance control that you suspect shock. Once you have called for emergency help, you can then loosen any tight clothing around their neck, chest and waist. Stay with the casualty and keep them warm by covering them with a blanket or coats. Try to reassure them and keep them calm. Keep monitoring their level of response. If they become unresponsive, open their airway, check their breathing and prepare to treat someone who is unresponsive.
So here we have a wound to the palm of the hand. Wounds to the palm of the hand are going to bleed quite a lot because there's a very good blood supply to the palm of the hand itself. And we also need to be aware that it could have damaged tendons or nerves. So they need to go to hospital to get checked out. But our main aim with any severe bleeding is to control the bleeding and to get the wound covered. With a straight wound like this, we can apply direct pressure straight over the top of the wound. And we're going to ask the casualty to raise their arm up, raise the affected part above the level of the heart. That way we can reduce the bleeding, control the bleeding and think about covering it over. So if you keep the pressure on there for me, that's brilliant. So I'm going to take the first dressing and unroll to the sterile pad. Now what I want to do is swap the sterile pad for the tissue. So you take the tissue off and I'm going to put that over the top. That's brilliant. Okay, doing really well. Now I'm going to use a second dressing. We're going to leave it rolled up and we're going to place it in the palm of the hand in the same direction as the cut is going. Then we're going to close the casualty's fingers over the whole lot. So from here, all I need to do is cover the ends of the dressing. So we're going to use the long end to come round and round. And the only bit we're going to leave sticking out is her thumb. So if you stick your thumb in the air for me, brilliant, you're doing really well. Make sure, as you're doing your bandaging, that you continue to talk to your casualty, keep them reassured, and if they're feeling a little bit shaky and a little bit cold, find a blanket just to keep them nice and warm. When the ends come together, you're going to tie a knot. You can tie the knot around the wrist, just make sure you're not going too tightly and cutting off the circulation. And the best way to do that is to use the thumb. So we can use it to do what's called a pinch test, where we just press on the finger for 5 seconds, and when we let go, we want to see all the blood rush back underneath. This tells us that although we've controlled the bleeding, we haven't cut the circulation off to the hand.
Remember, generally speaking, there are 3 different types of bleeding. Arterial, which is the worst and the most hard to control, it's under pressure and it gushes. The second is venous bleeding. It's under negative pressure and is more like a running or dripping, but it's usually pretty easy to control as well with direct pressure. And the third type is capillary. We see these most often in incidences where somebody actually scrapes their arm, which is exactly what happened to this guy. So he was running, he tripped and fell. He skinned his arm on the pavement trail, and now we've got some things to think about. First things first though, we have to be careful not to get drawn into the immediate visual of this abrasion. I want to be thinking about other areas of his body first that might be actually life-threatening, like did he hit his head on the ground? Did he hurt his neck? Does he have any fractures? As soon as I've established that he does not feel or have any pain in areas that could be life-threatening, I know that this may not be a 911 call, but more of just how to handle this abrasion. So this is what we're going to do. The first thing first is that we're going to actually debride or clean the wound. As you can see, he's got some dirt in there. He's got a couple rocks. If they're embedded, don't usually try to pick them out yourself. It's a great amount of discomfort to the victim themselves, and it may be something that the urgent care center or hospital will want to do to make sure they get all of it out. But in this case, we're going to start with running water. Just running water over the wound. Brushing it out a little bit. We've got clean gloves on. Getting all that dirt, cleaning some of the excess blood off. As you can see, there's still a little bit of dirt in there. We can keep washing it until we feel confident that we've got it out. You could also use a local drinking fountain if you didn't have bottled water available. I also thought for this topic, I might touch on practical application as well as the ideal situation. You're out at the park, you're hanging out, you might have a couple napkins from the local fast food restaurant. If that's all you have, you could use that to dab the wound, to stop the immediate bleeding, and to get it under control. Ideally though, we have sterile dressings in a first aid kit in the trunk that we can use to kind of debride the wound and keep the wound clean and dry. Once we believe that that is all cleaned up and the bleeding's under control, I start thinking about what size bandage I'm gonna need. If we don't have a bandage, it could probably wait till home. Put on some triple antibiotic to stop any type of infection from occurring. Leave it open air, have them be careful with it, and you're probably good to go. But let's say we do have Band-Aids with us. Is it going to be the regular 1x3? Not gonna happen. Too big of an abrasion. So I took out my 3x4, which is a perfect size for this size abrasion. It's a non-adhesive, which means it was developed so that it didn't stick to the actual tissue itself. So after I put my triple antibiotic cream, I'm now gonna cover it with my sterile dressing. To hold that in place, can you hold that for me? I'm gonna rip a couple pieces of medical tape. I'm gonna apply one to the top, and I'm gonna apply one to the bottom, and bingo, we're all set to get them home and do a little bit better job on the bandaging. Now, some couple points of interest here. You might remember doing like the peroxide cleanse and things like that. We're steering away from those as we're finding out that actually peroxide is a little harsh on tissue. It's better just to take clean water, potable water, clean out the wound, get it to stop bleeding. Very easy with capillary wounds. Bandage it after we put triple antibiotic on it, and you're ready to get back into action.